Welcome, ladies and gentlemen, to sqadia.com. My name is Muhammad Osama, and we are talking about data collection in medical statistics and research. And the topic of this lecture is designing questions. So, in this lecture, we're going to talk about facts and opinions and the difference between them. We're also going to talk about open and closed-ended questions, and we're also going to talk about how can we design good questions. So designing questions. Designing question is an art as much it is a science. And it is very important to design a good question, because if it is a well-designed and a well-defined question, then it can get you a better response and a better data for your study. There are different types of questions, and those questions can focus on different things in medical research and in research of any kind. So these questions can have you answers in the form of facts, opinions, views, and feelings. Facts are something which is very accurate, which is the same for any environment, for anyone, for any person. And opinions, views, and feelings change from person to person, place to place, and time to time. And they are more subjective. Let's start off with facts. The answer to a question of fact is absolute in that there is a single true answer. For example, there's a question, are you married? Yes or no. So there's an absolute answer to it. And that answer would be the same for that person. Either you ask him right now, or later on in the day, or tomorrow, or day after tomorrow. So that would stay the same. Similarly, height. What is your height? The person would say, my height is this. And that would stay the same if you ask it for any other day. And if anyone asks, what is your height? That person would give the same response to any person who asked that question. So that is a fact. Subjects sometimes may not give the correct answer, either deliberately or unintentionally, such as self-reported weight, because people may not know. They don't know what their weight is. For example, they make a guess, okay, I think my weight is around 62 kg, but that was a guess, so it may be inaccurate, but it was unintentional. He didn't know. Moreover, partly because they may report it inaccurately. For example, we ask someone about something which is very personal, such as what is your monthly income, and the person may not want to give us an exact figure, so that would be intentional as well. Other facts such as measurements of height may be inaccurate due to measurement errors. So sometimes it may not depend on the person who is answering the question, or it may in fact depend on the instrument which is measuring that. For example, I am measuring cervical range of motion with a goniometer. So it also depends on the validity and reliability of that measuring instrument that I'm getting the correct figure or not. On the other hand, we have opinions, views, and feelings, which are subjective and are subjected to change. So they're pretty much difficult to ask, and the responses are harder to interpret, because the answer may change depending on the way you ask that question, first of all. And secondly, the answers may be vague and they may differ from person to person. Seemingly similar people may give different responses to the same question. Like, for example, are you satisfied with your care? Even though everyone is receiving the same care and everyone has the same condition, but some people may say, yes, I'm satisfied with my care, and some people say that I'm not sure, and some people may say that, no, I'm not satisfied with my care. Responses may even vary from day to day in the same person. The same person may well say that I'm having no pain today, but tomorrow he may say that, yes, I am having a lot of pain and it's very disturbing for me. Response can also be affected by the way in which the question is asked. Sometimes leading questions may give you inaccurate responses as well. And it is very important to be very careful when you're asking a leading question. And it is best to ask a question which is very neutrally worded in its sense. For example, do you have any complaints about this service, or are you satisfied with this service? So when you say, are you satisfied with this service, you have given him the answer of yes, maybe, no. But do you have any complaints about this service? So that would actually give a completely different answer from that individual. So depending on how you ask that question, the response is going to be very different. And another difference is that this is pretty much closed-ended and this is open-ended as well. So we just looked at the facts and opinions. Now, what are actually the examples? So let's take a look at the different examples for facts and opinion questions. So how old are you? Now, this is a question which is focusing on a fact. Similarly, do you smoke cigarette? Yes or no? So it is again a fact. How old are you? It's going to be an age, and that age would be the same for everyone. For example, every 21-year-old would say, I am 21. It's not going to change from person to person. So when you talk about opinions, was your last clinic appointment long enough? So for some person, it may be long enough, and for some person, it may not be. And how do you rate your pain today? Now, everyone would have a different pain threshold, and they would have the same condition, the same severity of the disease, but they would give a different answer because it's an opinion, it's a feeling. So, and were you satisfied with your recent hospital stay? Now, that also depends on the person. It is also subjective. Now, there are open-ended questions and there are closed-ended questions. So open-ended questions are more focused toward the patient or the person from whom you are asking the question. So these questions where the response is not predetermined by the researcher, so you cannot code for these questions in advance, and the answers to open questions cannot be coded as they stand, as I already said. And for coding to be possible, similar responses needed to be grouped in some categories, and unique codes are assigned to each category, and they are done after the collection of the data, in opposition to the closed-ended question in which you decide the codes before collecting the data. The groupings chosen will be influenced by the purpose of the question within the study. So let's take an example of an open-ended question. Tell us how you feel about your recent hospital stay. Now, the response is not predetermined by the researcher, so it is an open-ended question. Or as a follow-up to another question where the subject has answered yes and further details are sought, you can ask another open-ended question. If you answered yes, explain why. For example, are you satisfied with your job? Yes or no? And then you can ask the next question. If you are not answered, if you have answered no, please explain why. That why you are not satisfied with your job. So that is an example of two examples of open-ended questions. Moving on, we have closed-ended questions, and here the possible answers are pre-specified by the researchers. They are predetermined. So they can either be facts or opinion. For example, do you smoke cigarettes? Yes or no. Or similarly with the subjective pain question, which is actually an opinion. So how do you rate your pain today? No pain, mild pain, moderate pain, severe pain. Now, both are closed-ended, but one is a fact and one is an opinion. Don't know can also be a possible response, which may be given as an option in different types of researches or different type of questions. Now, how to design good questions? What are the key elements for it? There are three key elements: expression and language, content, and precision. So what do we mean by these two things? So let's start off with expression and language. So first and most important thing when we talk about expression and language is it should be simple and the sentences should be short. So the vocabulary that you use should be understandable by everyone who is participating in that study. For example, use start rather than commence because it is an easier word. When the research involves patients, use lay terms for medical conditions and treatments. For example, use womb rather than uterus and shortness of breath rather than dyspnea. Avoid double negatives. For example, is it true that there isn't a day when you don't feel pain? It is very confusing because is it true that there isn't a day when you don't feel pain? So there are two negatives. So the person answering this question may get confused. So it would be easier to understand this question when it is phrased as, is it true that you feel pain every day? Now the person, it would not be confused answering this question, or do you feel pain every day? So the question should be easy when it comes to expression and language. The second thing is about content. So make sure each question only asks one thing. So for example, do you drink tea and coffee? Now that is a very poor question because the person who drinks either tea or either coffee or who takes both, all of them are going to say yes, but they are different categories. So you should ask, do you drink tea? Do you drink coffee? So you should keep these two questions separate. Second of all, be careful that close-ended questions include all possible options. For example, how many times you have seen the general practitioner this year? 1 to 2 times, 3 to 4 times, 5 times or more. But there may be a person who hasn't visited the general practitioner this year. So you need to include that option as well. And you missed out on that important data. Be careful with the use of leading questions as the response will be affected by how the question is asked, as I already mentioned, and that is very important because you can actually influence the patient's or a person's response. Now, the third thing which we are talking about was precision. So avoid subjective words such as usually and frequently because people will interpret them in different ways. For example, I think that usually means 3 times a week, and there may be a person who thinks that usually means 5 times a week. So it is different for every person. So do not use subjective words. The question should be accurate. So do you usually eat vegetables? Now, I do not know what the researcher means by usually, or do you get frequent headaches? I once again do not know what is meant by frequent here. The best way to ask such a question is to divide it into two. For example, we are talking about do you eat vegetables? Question and answer will be yes or no. If the person answers yes, then the next question would be how often do you eat vegetables? So then you can ask the question and the answer would be, let's suppose, 5 times a week. So that's how you can ask such a question. Give units for measurements and allow for responses. So for example, if you ask height, mention that you need height in what unit so that everyone would not be giving the responses in different units, and that will be difficult to manage the data in that sense. Consider when to allow a don't know option for closed questions as well. So that was all about this lecture, and I hope you learned something new out of it. So keep on watching sqadia.com for more lectures like this. Thank you very much.